of the more unfortunate aspects of getting older is that your joints begin to wear out, oftentimes for no good reason. This wear and tear of the joints is not only common in the knees and the hips, but also in the spine. Degenerative disc disease is when normal changes that take place in the disc of your spine cause pain. Despite its name, this condition isn't actually a disease. Degenerative disc is a condition caused over time by injuries, sports, daily activities, or if a spinal disc dries out and shrinks. Spinal discs are like shock absorbers between the vertebrae or bones of your spine. They help your back stay flexible so you can bend and twist. As you get older, they can show signs of wear and tear. They begin to break down and may not work as well. Nearly everyone's discs break down over time, but not everyone feels pain. If worn out spinal discs are the reason you are hurting, you have probably degenerative disc disease. Today on your regular health talk show, the physician will be discussing degenerative disc disease, the types, signs, the symptoms, possible risk factors, and of course complications. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, the regular anchor on this program, and with me is my co-anchor, very intelligent and beautiful, Dr.
Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
So today we'll be discussing degenerative spine diseases, the risk factors, the different types, complications possible, and of course, the causes. Dr. May, degenerative spine diseases. What comes to mind?
When I hear about that, I just think of the elderly, and I don't know why, you know, because I think maybe people are, the first experience I had in med school was in the elderly, and an elderly patient, and then and it was quite very, you know, revealing for me then as a med school student. But of course with time I knew that this is not an elderly, like it has to be somebody that you get to a certain age. And now with post-COVID,
a lot of things have happened.
A lot has happened.
Because you said what comes to mind is the elderly, right?
Exactly.
Probably because as you age, things begins to come in.
Exactly, because it's
but
degenerative.
Now, from what we're seeing, I don't think that actually can actually go with that.
No, it's not.
It's no more a disease of the elderly. A lot of things can be held accountable for this.
Risk factors.
Risk factors. Now people just really do not sit properly. That's what I
said with COVID and then social media. So there are two things that I see now that kind of bring forth, like this is going to be more common. These days, you even know when you just, you know, and then everybody is behind the keyboard and
that is not
it's so common.
And that is actually not the actual position.
Exactly.
We're supposed to actually sit upright and the position, but now everyone is like this. So you find out even children will also have this.
It's even worse because they are always pressing. No, that's why parents will say this one is always pressing his phone or her phone. And you know what? It's alarming. How people are having more pain.
But you know, even for children, I think the parents actually have to be held accountable, because most parents these days, for children to stop crying, they give them the phone, they give them the tablet to play with.
Especially toddlers.
Yes.
And that is quite pathetic.
Well, I can't wait for our guests to come on
I'm
board.
happy about that.
I'm very, very happy. The kind of guests we're having that will be on here today on your program. We'll be back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome back. If you have just joined us, you're on your regular health TV talk show, The Physicians, where your health is our business. Today we'll be discussing degenerative spine diseases. And with me in the studio, like I said much earlier, apart from my co-anchor, we have a consultant neurosurgeon. He's actually the first neurosurgeon on our program, The Physician. I've always told you that we'll try as much as possible to bring the best that is within our reach. He is no other person than Dr. OMOTAYO Ojo. He's also the president of the Nigerian the president of the Nigerian Spine Society. Dr. OMOTAYO, you're welcome to our program.
Thank you very much.
You're
Thank
welcome,
you for having me.
I'm very excited having you. You're actually the first neurosurgeon on our program, and it's a privilege to have you here.
I'm glad to be here.
Thank you. So let's first of all, we'll talk about the spine, because we're discussing the degenerative spine diseases. So let's have at least an overview of the spine. How does it look like, and where can we have disease conditions coming?
When a man stands up, or a woman, it is the spine that holds us erect. And there are different parts to the spine. There is the cervical, there is the thoracic, there is the lumbar. And we stand, sit, walk on our spine. So without spine, we cannot sit. We'll just be like vegetable or lying down. It is very important because everything we do, we use the spine. The aim of the spine is some part of the body to keep us flexible. For instance, if I have to shake my head, if I have to turn, if I have to bend, I put the spine to use. It is extremely important for everything we do as human beings.
That is important.
And this spine, they are actually in different parts. Small bones that are joined together by what we call the disc. So we have one bone, we have a disc, another bone. The disc that joins the spine, more or less they are the shock absorbers, preventing the bone, the different pieces from moving over one another, over each other. And also they give flexibility to the spine so that the spine would move as a whole rather than moving in pieces.
Okay, so now you have given us an overview. So what is now, because you talked about the bones and you have the shock absorber, you also have them in between. So what is now a degenerative spine disease? What is it?
Literally speaking, like everything else, we age. I mean, if you bought a car 20 years ago, you would never compare that car to a brand new one you're just getting today.
Sure.
Yeah.
So with use, the spine will get, well, I think literally it's more like a wear and tear effect on the bone itself, and more particularly on the disc, which I call more or less like the shock absorber. So as we age, as we use the spine, different activities will put a lot of pressure on these discs, and when they wear out, there could be problems.
It's getting more interesting, you know, because,
scary.
and the description sits so well with the fact that, you know, without the spine, you can't sit. We can't sit here now the way we are sitting, and with age, anything can happen. So age and usage, because I picked those two things from the way you broke it down. So are there different types of this degenerative spine disease?
There are different types, but what we will be talking about is the different activities or factors that can lead to the same thing that we call the degenerative spine disease.
Okay.
For instance, aging that I mentioned, the different activities we do work-wise, in some cases, maybe injury, trauma, more or less things like that. So we don't actually say there are types, but we can talk about the progression, the early changes up to the late changes where the spine can actually, the vertebrae can actually dislocate one from another, especially when the disc is completely gone. So we'll be talking about the progression of the disc degeneration.
Okay. So talking about the progression of the disc degeneration, maybe we should just quickly go straight to the possible risk factors and the causes.
I think this is what is very important for us to know.
Okay.
Apart from aging, I tell people, especially some that will ask, is it what I did or I didn't do? I tell them, it is a receipt for your hard work. Because I see this in people that have worked very hard when they were younger. So it's not as if what they did yesterday or 2 days ago is an accumulation of their lifetime.
Okay.
So aging, if we all get old enough, we will have some degree of degeneration.
Okay.
Activities. So we see this in people that sit down for a long time, work at desk, and I have to put it this way. You know, when you like what you do, time doesn't matter.
True.
Exactly.
So we have technicians, IT people, programming, and 3 hours would go, they wouldn't know.
At all.
We have long distance driver, and I have to make a caveat on that. If you have to drive from mainland to highland, it could equate to a long distance drive
With
from
traffic,
Lagos
yes.
to Ibadan. So anything that makes you sit long enough will degenerate the disc. And this is because the disc is like sponge. If you press it hard enough, the water would go. It becomes dry, then it can break.
Okay.
So if you have that mentality, anything you do, you see it would cause that. The other thing that I tend to see recently is the effect of social media.
That's been an epidemic right
So
now.
I think
you
we
see
should lay emphasis
people
more on that.
sitting down on social media, bending the neck, and I have to say this, you see, many years ago, like I said, it used to be a disease of aging.
Yeah.
But we are seeing it now in younger people, active people on social media. When you bend your neck in an awkward position, the type you do when you want to quickly reply a mail, you want to look at what is happening on social media, you redistribute the forces in the neck. And you bend it and you put the disc on extra pressure and you lose the water there, it dries off, and over time it will age quicker, and then there will be a problem. So age, activities, work effect, and recreational activities, all these are major factors that will quickly degenerate the disc and make the spine age.
There's something you said, sir, something about sitting for long. Is there like a duration to that? So people can also, they can relate if you sit for more than 1 hour or more than 2 hours, or what do you do in an hour? How many minutes should you move around before coming back, so that we can break it down for our
So if I
audience?
put it in perspective,
Yes,
the
sir.
disc is like sponge.
Yes.
That is actually the anatomical configuration of it. If you press it longer than 2 hours, it starts drying off. And what you can do is to time yourself. After 2 hours, stand up, take a walk, and come back. You relieve the pressure there. For many people that may forget, if you drink a lot of water, you will have to go to the restroom.
Yeah.
And that will break the
That
cycle.
will break the cycle.
Even if you're on a long distance flight, take time off, stand up, walk around, then you'll be saving your disc.
This information is very, 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 very important, because now that we have people working from home, the tendency is to sit for a very long time
Very.
working. Unlike when you are actually in an office space, you have your colleagues around. Somehow distraction comes, you're able to stand up, move around, or drop a memo or something. But these days you don't even do that. You just sit from morning till night. The only time you probably will work is probably put your coffee beside you. And so I needed to throw more emphasis on this, why this will have more impact on them.
So for many standard offices, they have occupational health officers coming to look at the office and making sure that the office is suited for the type of work they do. But with the advent of working from home, many people now work at home and probably sit on the same sofa they would sit when they have visitors, and they may work for a long time just in that comfort zone, especially some on bed, some on chairs that are not for work, except few that would have workstations. So that change in habit would lead to redistribution of forces and activities in the spine, It may be the lower back, the lumbar, or it may be the neck if the table is not good enough. I mean, if you are there on your sofa and you're working on the laptop, you put forces on your neck. If you are there on the sofa, not appropriately positioned, you put the forces on your back. So it is a problem. You may not know now because, like I said, it takes a long time, but by the time it will come, it may be a challenge. So if you have to work from home, it may be ideal for you to have a workstation, or be sure that you have a proper seat with a table that would not make you bend your neck or slouch inappropriately. The neck and the back are extremely important for everything you do, but if you misuse them, you will pay for it at some point.
What are the symptoms and how do we make that diagnosis that this is a degenerative spine disease?
So I will answer that, but I had an experience sometimes when a young lady came and she had her neck bent and she was in agony. And while taking the history, I realized that she watches movie on her mobile phone.
So she's
And an average length is like maybe 1 hour, 30 minutes. And she would do this all day until one day it became an issue. But back to your question, how do they present? From the mundane to ridiculous, from mild pain to terrible pain where one is not able to use the hand. And you see, if you look back to people in the village or people without access to medical care, when they start getting to 50, 60, they start using the stick. And if nothing is done, at some point, they're never going to be able to walk again, and they will have to be carried all around. But typically, it will present with pain that may come and go. And at that time, never usually an issue until the pain stays longer and no longer responding to medical therapy. In some cases, it will be associated with numbness. They kind of say, no, I can't feel the leg very well, or my hand is feeling like it's not mine. To the people at the extreme of affluence, they begin to realize that their signature is not regular anymore. Or sitting down is now an issue. They have to stand up, wriggle around, and so on and so forth. When it gets worse, and at this point we have what we call the red flags. If you see any of these, you must see a doctor. Pain that is terrible, keeping you away from sleeping at night. Leg that is becoming weak. Hand that can't really sense hotness of your cup of tea. I mean, you take the cup of tea, it looks normal, but you put it in your mouth, it burns. It shows that your hand is not sensitive enough. For both sexes, incontinence, you can't control your urine, it comes out when you're not ready, or you can't hold it long enough, or the stool is getting very hard. I mean, with all the associated pain and weakness in the leg. For men, there is association with an erectile dysfunction. So when you see all these, pain getting terrible, you can't feel very well in your private part, weakness of the leg, erectile dysfunction, and you can't control your waterworks, then you must see a doctor. And the extreme of it is when you can no longer walk.
That is the extreme.
Yes.
But what happens if it's not treated?
So just like the analogy that I gave with people using all their life to farm or to do strenuous activities, if it is not treated, everything that I've mentioned will come up at some point.
Wow.
So I just want to ask, because you talked about people slouching and the kind of position. Does standing for a very long time also have an effect on the spine?
Oh yes,
Stand for a long time?
because I mentioned that we use our spine to stand. So if you're standing for a long time, your lower back is carrying your weight, and the disc would get degenerate and will start breaking. And at that point, you see, the way it actually works is that the disc jacks up the spine. So when you lose the disc, the spine would come together. When you walk, sit, or stand, the bone will rub one another on top of the other, and that will generate pain. But more importantly are the nerve roots coming out from the spine. When the disc is no longer there,
So there's a
the
compression.
vertebrae will join together, and that will press on the nerve.
Nerves.
And that is what gives the excruciating pain that comes from the back and goes down the leg. In some instances, there will also be numbness, comes from the back and down to the leg. And if the nerve is pressed hard enough, it stops working. And that is why you see people, they don't know when the slippers is falling off their leg. They can't carry their legs very well. They can't take the staircase well enough, and the pain is terrible.
It's actually very interesting because it's important that we know that not all the pains that you have on your legs are just from there. So it's actually like a referred pain. The problem may actually be coming from the spine. Meanwhile, you are feeling it on the legs. So that quickly takes us to preventive measures. So what are the preventive measures? What do you advise?
I think a lot of awareness should go out there. People should know what to do and what not to do. How to carry stuffs, how to bend down, and your work ethics, how you walk, how you sit down at work, how long is good enough to sit or to stand. When we are clear with this awareness, then people will know what to do, and perhaps we may be able to prevent some. We can't tell people not to walk, but we can tell them how to walk better. There are some we can advise. There are some that whatever you do, the children will do whatever they like. But if you have a workstation at home, especially teenagers, or when you want to do your homework, when you want to do your assignment, this is how to sit. Don't do this. I mean, when we were in primary school, we did everything, just bend and do the work. But now, try to keep your system almost at the same level with your eye, so that you're doing this rather than doing
that.
I mean, laptop is like this. It should be like this. And for people like you mentioned, youngsters, they like what they do, they get engrossed. Tell them to take a break sometimes. Just walk around and come back to what you're doing. For adults, it's easy. Drink plenty of water, you'll be forced to go to the restroom. So you should start talking to children that your neck is important, your back is important, and these are the ways you can make the back better. You want to pick something from the floor, rather than just bend, just stool them and pick what you have to do. It will take some time, but with awareness, with constant reminding, people would get better at it.
So before I let you go, maybe our viewers need to also understand, talking about the possible complication, right? I want you to come from the aspect of people knowing that the brain is a continuation, that you also see in the spinal cord. So what could happen if really you have those complications? What can happen to an individual?
So it's quite difficult and quite challenging. For many people, especially when they present late, some you can no longer help. Like you mentioned, everything we do, the impulse will start from the brain, and it will go through the spinal cord to the different nerves coming out at different parts of the body. When this condition is left unattended to, it gets to a time that whatever you do, you are not able to help the situation anymore. And you see a young man that may be confined to a wheelchair for life, or you see somebody who will be in agony for the rest of his or her life. So the idea actually is, if you have pain that is not going, you should have it checked out. And if you are not satisfied, please ask for a CT scan or an MRI preferably, and get a specialist to have a look. It's not all that will require surgery, because I know that's what everybody is afraid of. Some may just be postural changes, physiotherapy, some medications and advice, and so on and so forth.
Okay. So Dr. OMOTAYO, as a neurosurgeon, do you really have the facilities managing patients that come with conditions that have to do with it?
Oh, very much so. It can be done very well in Nigeria. And there are many places, many states, many facilities, teaching hospitals, private hospitals, where you can get excellent help, the type that you would get even if you traveled outside the country. For the basics, you don't really need much. You just need somebody who knows what he or she is doing and the basic setup, and they can relieve the nerves, advise you, do microsurgery, and let you be. And to the extreme, when you really need complex surgeries, it can actually be done in Nigeria.
Thank you very much. Final words for our audience?
So, you have to take care of your back. You have to watch out for your neck. Everything you do, you have to be conscious how you sit, how you stand, and where you walk. If you have any problem with your neck pain, or your back pain going to the legs, neck pain going to the hands, please have it checked out early rather than later. Thank you.
Thank you very much for coming on our program.
You're welcome.
I'm sure we'll see call again so that you at least come and enlighten our audience, because you have really opened our eyes to the fact that what we do to our own self, the harm that it portends in using our phones, tablets, social media, always focus there. I think majority of people are really spending most of their time on checking out information from social media. So, like you said in the program, epidemic. So we need to actually take a very good look at it. Thank you so much.
You're
and
welcome.
to our viewers, I just want to say thank you for being part of our program today. Like you heard what he said, be conscious of how you position yourself. Don't slouch. Don't focus so much on your tablets, on your phones, because if you do not take care of it now, the challenge is not far from here. Till next time, stay blessed. My name is Dr. Martina Agberian.
Thank you very much, Dr. Joe. I hope next time we call you indulge us. Not only our audience gaining from this discussion today, I gain immensely. Thank you very much. To our audience out there, you've all had it. You know, with regards to your spine, you sit, you walk, you stand. It's the spine that plays a significant role. And please, when you have that pain that is not going anywhere, especially if it's excruciating, and if you're a man, you have been something that has to do with erectile dysfunction, or you have been, issue with incontinence, whether you're a man or a woman, that is the time for you to now see your doctor. Please don't continue with the painkillers. See your doctor immediately and get it checked out. Be kind to follow us on all our various social media platforms, the X Space, Instagram, Facebook, LinkedIn, and you can binge on our previous episodes on YouTube, The Physicians NG. Please go there. We have over 200 episodes there. Just know that the information you get there, they are authentic from real people doing great work. Until next time, my name is Dr. Memona Yusuf Kadri.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.